So I'm Dr. Rasheed Musaheb. I'm a GP and aesthetic physician. I also work in the field of sexual rejuvenation. So today we're going to talk a little bit about the P-shot and in relation to Peyronie's disease. So Peyronie's disease is a condition where there is a plaque formed, or like a lump formed under the skin of the penis, where the penis develops a curvature. It has two stages. One stage is the first stage is the acute stage, where erections are painful and the plaque starts to develop. And the second stage is where the pain has dissipated, whether you have performed any treatment or not. The pain in the course of the disease is likely to go. Then the plaque settles, and that causes curvature of the penis, depending on the angle of the curvature. That can prevent or impact intercourse. So how do we treat Peyronie's disease? Peyronie's disease, as we can see, there is a plaque. So ideally, we prevent the plaque from molding into something which is hard enough to lead to an angle or a curvature. So we can do that in a few ways. We can use the P-shot. The P-shot, we inject the plasma into the plaque in different ways, and we try to subsize the plaque or break the plaque up a little bit with the needle. The plasma has been proven to lead to more organized healing, while the scarring process, which is the plaque, is disorganized and eventually tends to become calcified, where it is more difficult to treat. So early on in the course of the disease, treatment is likely to be more successful. Other modalities that we could use to treat Peyronie's disease is surgery. So one of the surgical modalities which is going to be offered to patients of Peyronie's disease is called the Nesbit procedure, where the curvature is basically the longer side of the penis is aligned to match the curved side. So that eventually entails like a significant shortening of the penis. Already with the disease, which is Peyronie's disease, the plaque or the scar formed in the penis is going to prevent the expansion of the erectile tissue, and that is going to cause shortening of the penis. So now you have another procedure which is going to shorten it even further, and that shortening will eventually be irreversible. And surgery has its own downtime, and it's not suitable for everybody who has certain chronic conditions. So surgery is not to be taken lightly, and most people will not find shortening of their penis like something which is acceptable. With the P-shot, what we do, we re-inject the plasma or the platelets, the regenerative part of blood, into the erectile tissue. That can help with maintaining length, and also can help prevent the scar from contracting to the point that it shortens the penis. We also advise people who suffer from Peyronie's disease to use a pump which is going to stretch the penis, and then a device called either Phallosan or Restorex. Now, Phallosan or Restorex, they pull on the penis, they pull on the scar and prevent the scar from contracting, which is going to lead to further deformity. Restorex is such a device that you can counter the curvature of your penis from the device itself. So if your penis, for example, curves upwards, you can bend the penis downwards while stretching it, and that helps with softening the plaque and preventing sharper angles which are going to limit intercourse. There's another treatment which has been quite popular on the internet regarding Peyronie's disease is shockwave. Shockwave, while it can be useful for erectile dysfunction, has not been proved to be very useful in terms of Peyronie's disease. So though it can limit the pain that people experience in the beginning of the disease, it won't affect anything in the course of the disease. It won't break down the plaque. It won't soften the plaque either. The pain in any case was going to settle along the course of the disease, whether you would have done something or not. If Peyronie's disease is accompanied by erectile dysfunction, shockwave can help But if not, if your erectile function is preserved, shockwave is not such a useful procedure.